Okay, thanks, Laura. So I'm Lindsay Corcoran with Stroudwater, and if I just want to do a quick overview of the project and the swing bed directory that you all are involved in, and just in case you weren't at our September meeting. Really, this project, this swing bed directory is what we're calling it. Is a first, it's a web-based application, and so we're going to be going over the web-based application part of it and the website and the data entry part today. And it's in that part is where users are going to log in and they're going to make selections within our database, really around your hospital swing bed program. And you're only going to have to enter this information once. So I just want to point that out. And with that information, we begin to kind of develop what we call our care delivery spectrum. And it's around the process of identifying services, resources, staff provided by your hospital, and understanding some of those gaps in service delivery, or if there's any opportunities to fill those gaps or expand services. So that's around creating your kind of your swing bed care delivery spectrum. And the web-based portal or application of the swing bed directory is also going to serve as basically a marketing tool that you could leverage with your referral hospitals, so they understand the services, the competencies that you all have relative to your swing bed program, and we can highlight that with your referral sources. So back in September, October, you all should have received from Laura and her team a paper version of the self-assessment. So basically, it's everything that's on that web-based tool is going to be in that paper self-assessment. And so the recommendation is really, and if you haven't gotten to that, the recommendation is really creating this interdisciplinary team to complete that self-assessment. There are questions and topics related to, essential supply, potentially about your equipment and what equipment you may have for your, pertinent to swing bed patients. There's questions around case management and transitions of care. So we want to make sure that we have all the right people at the table when you look and start to fill out that self-assessment. So creating that interdisciplinary team, and these are some of the suggestions of the folks we would want on that team to help answer some of those questions. And then this is just a screenshot of the paper form that you and then the Excel-based paper form that you may have received. And so we'll have some questions at the end just to understand if you are utilizing that paper form or not. So with that, I'm going to pass it over to Paula, and she's going to go over some onboarding and housekeeping.
Thanks, Lindsay. This is Paula Knowlton with Stroudwater. So for the onboarding process, you should have already received from Laura the end user form, and I have received 15 back. So we now have 15 hospitals that have started the process for onboarding. So this is an important form to get back to me in order to let us know that you want to have access to the website and be part of the swing bed directory program. Another piece of the onboarding is having a master subscription agreement in place. And this is an agreement between Stroudwater and the hospital for the use of our website. There is no cost to the hospital for this program, as it's already been covered by the Office of Rural Health and the Flex Grant. We do ask that you'll have these reviewed and signed and returned. And a lot of people say, how long is this going to take? Because I really want access. It takes as long as it takes for your facility to process this. Some folks have to go through legal with them. Some folks are able to just have the CEO review and sign them. So it really depends on what the process is in your facility for these legal agreements. These agreements will come from Laura. I will get them to her next week, and she will send them all out to you, and then you can return them to me, and we'll make sure that we're tracking that information. This agreement has to be in place before I can grant you access to the website. So looking at the portal address, the registration and contact information, the portal address is there for you. It's portal.stroudwateranalytics.com. You're going to register for the website by clicking on sign up. I've noticed that a few of you have already registered. That's wonderful. You don't have to re-register. It's just going to take time for me to grant you access until I get that master subscription agreement back to you. My contact information is there. I'm available for any questions, whether it's to do with the website or any other process that we talk about with the Swing Bed directory. We do ask that you contact your IT folks and make sure that they whitelist stroudwater.com and stroudwateranalytics.com so that you are receiving all of the emails, not only from Lindsay and I, but also from our portal that will automatically come out to you. So I'm going to jump out of the PowerPoint and go to the website, because I want to show you what the website looks like and how you're going to navigate through this. This is sitting on what we call our staging site at this time, so it won't look exactly like this, but it's going to be very close. And once you log in, this is what you will see for the Swing Bed directory site. There's going to be a couple, we talked about the paper form. So if you've completed that paper form, you can take that and use it to enter into the website. If you haven't already completed the paper form, you can come directly into the website once you're granted access, of course, and answer those survey questions to do with your resources and your clinical programs. So I'll just click on resources for you, and it's going to bring up, the first one is wound care. So we're looking to see if you have the following resources or clinical competencies available within your facility for all of these questions. The first one is all nurses are trained in post-surgical wound generic. So you're either going to say yes or no, and you're just going to click on them. Yours will be completely blank. There won't be anything chosen when you go into it. You'll go through all of these questions, and then you just click on next and do orthopedics, and click on next and do cardiopulmonary, then nutrition, dialysis, education, around your providers, rehabilitation, care transitions, infrastructure, and then for your quality assurance performance improvement program. So those are the different areas. I know that there's a lot of questions there for you to answer, but really you're just answering the yes or no to those for the whole survey. The next part is the clinical programs. So this is where you're letting us know, out of these 18 clinical programs for your swing bed, do you provide these? And it's either, again, it's a yes or a no. These yes and no responses are going to tell us whether, oops, let me jump back for you. In your profile, if there is a conflict between your resources and your clinical programs, if there's a complete match, if there's an opportunity, or it just isn't applicable. So let me explain to you what these are. So this one says it's a match, which means I've answered yes to all of my cardiac rehab questions, and I offer cardiac rehab services in the swing bed. If there is a conflict, that means one of these responses was a no. So I don't have all of the resources or all of the resources available for my cardiac rehab services. The opportunity piece is if you've answered, here's one that's an opportunity, you've answered yes to all of the resource questions, but you do not offer the service, but you have the opportunity to do that. And then the NA is if you're missing one of these resources and you do not offer the service. Are there any questions with that?
Does that make sense to folks? I know this is your first time looking at the difference between, and Paula, maybe you want to bring up that grid that differentiates between conflict, match, and opportunity. I think it's a good visual representation about kind of how we've envisioned the different, kind of categories based on, and this is a good starting point. This is where we can start to have the conversation around, we have a gap, maybe, and is it an opportunity? We provide all these different resources, but we don't actually market our cardiac rehab services, or whatever it may be, wound care, but we do have all of the resources available, all of the clinical competencies available, but we haven't, promoted that service. Well, that's an opportunity. And so we want to, give us feedback. We are definitely open to some feedback when we can make some tweaks if this does not resonate with you all, or maybe we're spot on, and that would be great to hear as well. But this is going to be the tool and kind of some of the reporting that comes out of it, for at least for the kind of the initial reporting for this.
Hi, Lindsay. We had a question in the chat. If folks will be getting a copy of the presentation today.
Yes. I think. Paula, is that okay? Yes?
Oh, yeah, absolutely. And in the presentation, in the presentation, I've put in screenshots of each of the website pages as well.
And just realize that those are just screenshots, and they're not, you'd have to like actively scroll down to see all of it. That's included in each one of those. Yeah. But yes, good question. Yes, that you will have access to this slide deck. 3282. Melanie Martin, 3282. Any other questions before we around kind of the website and the portal, before we jump into some polling questions that we want to kind of stir some conversation? So try to get some insight.
Hello, this is Richard from Jefferson County.
Hi, Richard.
Hello, and I'm on your portal page right now. When will the assessment tool be uploaded so that I can access the questionnaires? I have.
Hi, Richard.
Hey, Paula.
How are you?
I'm well. Yourself?
Good, thanks. So we're in the process of QAing the website right now. It will be, it's going to go live on December 1st.
Okay.
So we have between now and December 1st for everyone to get their master subscription agreements in place. Now, if for you folks, you already have a master subscription agreement in place with us, but I will send an exhibit that's an addendum to that agreement that is for the directory. So we still have to have some paperwork in place before I can grant you access to the website.
All right. No worries. Sorry,
Okay.
I kind of jumped ahead, but thank you for the insight.
No, no problem.
Good question. I'm sure others had it as well. All right, so we are going to move on to some polling questions. And this is, we'd love to get your input. We're trying these polling questions out for the first time, and so hopefully you can, you're on the Zoom and you can do some selecting of answers. So Laura, if you want to pull this up. Basically, we want to understand, have you used the paper forms that were sent out, September and October to complete your self-assessments? In addition, and so these are related to the swing bed directory. And then in addition, I talked a little bit about how we can utilize this swing bed directory as a marketing resource for you all to market to your referral sources. So the second question is around, would you prefer a paper marketing material, something that you may email to your referral sources, go hand deliver, something tangible, or have your referral sources access the website and the portal, something electronic, to obtain information there? And what I'm talking about is information is your clinical, all of your clinical components that you can offer in your swing bed. Basically the nuts and bolts of your swing bed program that you would utilize to leverage, and to get referrals from your, partner hospitals or other referral sources to work to grow your swing bed program. So if you can go and select that and answer questions 1 and 2, that would be great. And then Laura, you can just let me know when we're okay to move on. Just
Okay.
given people a little bit of time to answer 1 and 2.
Yeah, we still have a few results coming in. So
Okay.
wait
I
another
didn't know what you could, yeah, what you could see on your end.
All right, I'll be closing in about 5 seconds. Oh, there's another.
And this is just good feedback for us as we're, continuing to evolve this directory, and we want to, make sure that we're utilizing it for our hospitals in the best of its, ability. So thank you for the feedback.
Okay, I'm going to go ahead and end this one and share it with everyone.
Perfect.
And share results. Okay, everyone should be able to see how everyone responded. Lindsay, can you see the responses?
Yep, I can. Thank you. So I don't know if anyone wants to pipe in, but if you answered you don't know on question 1, did you not receive the paper form? Or maybe you weren't the one who received it and didn't participate in filling it out. If anyone wants to chime in.
This is Richard. I don't know if we filled it out. So
Okay.
I'm one of the don't knows. So
Okay.
if it could be resent, I'd be happy to fill it out.
Yeah, let's do, Laura and Paula, what we'll do is we'll do a kind of another packaged email out to everyone who's on this webinar with the slide deck as well as the paper forms again, just so you can start to kind of work through it. As I said before, developing that, pulling together a team to go through the paper form might be easier for you all instead of just having one person do it. Okay, well, thank you. All right, now we're going to do a complete 180, and in the midst of this pandemic we are in, we at Stroudwater would like to get a sense of kind of what's going on as it relates to COVID at your hospital and swing bed. So I have a bunch of questions around whether you've seen an increase in your swing bed census, again keeping in mind the COVID and how your swing bed program has been potentially impacted by COVID. Whether or not you're caring for positive or under investigation patients within your swing bed program. Are you caring for patients post-COVID? So coming and getting some rehab after they've been on a ventilator or something like that. Are skilled nursing facilities in your area refusing to take patients at this time? So maybe you're seeing an increase in your swing bed because of that. Love to know if that's the case. Have you taken advantage of any of the 1135 waivers? So whether or not you're accepted swing bed patients that have not had the 3-day acute stay, for instance. Or what about any hospitals that have applied for the implementation of a swing bed program that have not? And that's part of the waiver that is out there as well. And any experience with any issues with billing or reimbursement for COVID patients within your swing bed program. And we want to know more about kind of the pressing issues right now that you're facing as it relates to COVID and your hospitals. So if you want to post that, Laura, we'll get some answers.
Okay, can everyone see the poll?
Yes.
Okay, good. Hi, everyone. This is Laura. There's still responses coming in, but I have been watching the chat. And so for the folks who are in Tulsa, I'll be sure to follow up with you guys later on this afternoon with some additional details and kind of more of the background. And then for everyone who said that they need the end user form or forms, I'll be sure to get those to you as well.
Yeah, we'll include all those documents in one email.
All right. We have about the same number of respondents from the last poll. So about 5 more seconds, and then we'll go ahead and close this one. All right, I'm going to close it and then share the results with everyone.
Okay. So I'm assuming you all can see the results. Certainly the staffing shortages are the most pressing issue for your hospitals right now. We certainly are hearing that with a lot of our other states, particularly in the Midwest, as you can imagine. So thank you for that. I wish I had a magic wand to triple our nursing leaders and make them all float down and help our hospitals right now. Okay, and then we've had some increased in census or stayed about the same. So, that's good. I mean, we like to see that we're increasing our swing bed census. So that's, and then around the question around asking if your referral sources are asking you to care for COVID positive or under investigation. So we are seeing more, little more than half answered yes to that question. And then, are you caring for post-COVID patients? Again, this about the same percentage there. And then we are seeing, 63% of skilled nursing facilities within, your communities are refusing patients. So again, that's that opportunity to leverage our swing beds and get some of those patients in. About 50% of you have applied some of those 1135 waivers, so that's great. And then not sure, most of you are, almost half not sure about the implementation of swing beds at other hospitals who have not or have applied the 1135 waiver to expand into swing bed. And then don't know about the billing. Well, if we have a lot of, care managers or nursing leaders on the phone, maybe that question doesn't trickle down to you all as, so not a problem there. I do want to, if we want to flip to the next slide, I think this would be, a good time if anyone wants to share kind of what's going on at your facility. We're obviously seeing this significant surge as it relates to COVID. And, the first 100,000 deaths were only 1/5, so about 20,000 occurred outside of urban areas. So more in our rural spaces. And now the second wave that we're seeing, there's more like 50,000 of those deaths are happening in rural. So significant increase in the effects of COVID in rural areas. So I'm just wanted to open it up for discussion. We're not going to take a full hour of your time for this webinar, but I do want to give you a chance if you want to share kind of what's going on, what are some of your stressors right now, what are you doing as it relates to your swing bed program for COVID patients? Have you been able to increase your services or your competencies to care for these COVID patients within your swing bed? We'd love to hear from you. Don't be shy. But we'll spend just a couple minutes hearing from you.
Hey, Lindsay, this is Laura. We did have an additional comment that an additional pressing issue for one of our facilities continues to be payer sources for referred patients.
That's a yes, and that's a topic of conversation. So that's a great, thank you for bringing that up, because what I also wanted to reiterate is part of this project will be around education. And so there is a steering committee that is meeting on a quarterly basis for a handful of hospitals in Oklahoma that are meeting and to kind of share some insights about what's going on at your hospitals and what would be most beneficial for you all from an education perspective. And so that's where I and Stroudwater can pull together, education for you all. And one of the topics will be around, optimizing your payer sources. So we've heard from a lot of states and hospitals that, we're hearing from billing that we can only take Medicare patients in our swing bed program. And so we want to, help give you some ideas, additional ideas around accepting and expanding some of those payer sources into our swing bed program. So more to come. That's another webinar that will get into that topic. But if you do have other, pressing needs as it relates to swing bed, that could be a good education topic. Please feel free to share that with Laura, and she'll get that information to us. And we'll be setting up a quarterly touch base to go over some of that material.
This is Laura again. I put a comment in the chat, if anyone on this call, because I know we have some folks who weren't on our MB call, but if you would like to be added to the steering committee, please feel free to email me, and I put my email address in the chat.
Great, thanks, Laura.
Lori McMillan and Tishomingo, and I would say one of the challenges, we've been taking some COVID patients, but of course our challenge is that we don't have a very deep bench in terms of our staff, and so if we get very many coworkers positive, then we can't do anything. So we've been pretty cautious about it. We've had a few, but it's kind of a tricky balancing act. And then the second thing I think coming up that we're starting to try to work through is with the other hospitals getting full, we're seeing more people parking in our ED waiting for places to go, and kind of, trying to plan for how we're going to cover the, increased medical needs of some patients that normally we would be able to ship pretty quickly. So those are probably the two things that are hot on our list.
Yeah. Okay. Thanks for sharing. Anybody else have some, want to share what's going on at your hospital? Okay. Well, I don't have anything else to share. And again, I think the reminders are in the next steps is we will pull together all the materials from this call in addition to the various, master subscription agreement and the end user forms, and package that all up for you all, and make sure that you have everything. And then we'll get those back from you filled out. Those will be directed to Paula. And you can always include Laura in there if you want as well. But those will go to Paula, and then we will let you loose for the website December 1st. And then any questions that come up related to the website and entering data, those questions would also be directed to Paula, and all of our contact information is in this slide deck as well. And then we'll set up the various next kind of touch bases and webinars, as well as the next steering committee too. So look for emails and calendar invites for those coming through. But I certainly appreciate everyone's time in joining this webinar today, and really looking forward to working with you all and on this project, and get that swing bed marketing and opportunities for growth ramped up.
Thank you, guys. Yes, and if anyone has any follow-up questions, please feel free to reach out to me, and I'll be in touch once we get the slides and information. I'll send it out to everyone on the call today. So thank you all again.